eba yapomudin kasenso.
Today we will be looking at diabetes mellitus.
Na ene yebehwe esichirembo so.
Diabetes is simply high blood levels of sugar.
Na se yakase esichirembo so a ene kire se yemoja no esichire ewo mu no ekosoro.
If your sugar is above 7.0,
na sa esichire ewo moja mu no ko 7.0 a,
you are likely to have diabetes.
na akwanya ma o se obetumi ni esichire yare.
This value is for fasting blood sugar.
Na we nhwehwemu de pefe se we che se moja no esichire ewo mu no ekosoro.
If you check your sugar and it's above 7.0 after you have fasted,
na sa wo hwehwe moja mu no hu se esichire ewo mu no ekosoro a,
then you are diabetic.
eno na yebetumi esinipi akase when esichire yare.
Diabetes can give you very clear signs and symptoms.
Na esichire yare betumi ama ma wonu enwema nkitinkiti bi ewo nipadua mu.
You feel like drinking water frequently.
Na etumi ma wo entantam so a wonu nsuo.
You visit the washroom frequently.
Na akwai se mbrini na wo dum so ntantam so.
And you are hungry.
Na ekom so taade won ntantam so.
These three signs,
Enwema mensa we
if you've noticed them,
wu ewo ho a,
you have to go so that you quickly check your blood sugar.
esantam pa wo kwa yasa bia ne yekohwe umoje mu se usikire na ewo mu ekosra na.
When you are sleeping
Sa wo da
and you wake up severally to urinate,
na wo soro ntantam so se wo dwo so a,
or you are always thirsty for water,
anase embre nyina akwai se isukom di wo a,
kindly go to a nearby clinic or hospital
esa wo kwa yasa bia
and they will check for diabetes.
na wo matumi ahwehwe se wo ne esichire yare yi bia na.
Diabetes is also a very serious disease.
Na esichire yare nso eye yare a eye hu ankasa.
You can develop stroke,
Na enam so betumi nya stroke yare yi.
can even become blind.
Eno so nam so bo ni so betumi asan efura.
So it is important
Nti ewu hia ankasa yie.
that you know your status.
So wo hu wo ankasa wo hu.
If there is a family history of diabetes,
Na se ye wo ebusua mu ewo ebusua mu nsam se ebusua ni bi ewo esichire yare yi bia.
your chances of developing diabetes is high.
Akwanya sa wo so benya bi no ewo soro.
There are basically three types of diabetes.
Na yeka esichire yare a ye wo mu ahoro impendensa.
The first is known as type 1 diabetes.
The edikan no the yebeka ne se eye type 1 esichire yare.
This type of diabetes,
Sa esichire yare we no,
the body does not produce the hormone insulin.
na nipadua no entumi fa hormones no emba.
Insulin is responsible for moving excess sugar into the muscle.
Na sa insulin no ene na enam so a ede esichire ne eba nipadua no mu.
If the sugar is more, insulin will help shift it into your muscles.
Na se esichire no eye bebra, insulin no epia ekọ wo ntini.
But if your body is unable to produce insulin,
Na se nipadua no entumi amfa insulin amba,
then there will be excess sugar in your blood.
na akwai enam sa akonya we so na wonya esikire bebre ewo moje mu.
This type 1 diabetes mostly occurs in children,
Sa esichire yare we dia eye nkwala na tanya.
and it contributes to about 5 to 10% of the diabetes cases.
Na yare tu susu pono so a yenya mu njamu edu anase enum ewo esichire yare mu.
Another type called type 2 diabetes.
The etosu no yakasa fa mu nso.
Type 2 diabetes contributes to almost 90 to 95% of the diabetes cases.
Na de etoso mienu se wo hwemu yie pefee dia eno nso e de sikyire yare yi eba e ma ne kosoro ankasa yie.
This type of diabetes, the body is producing insulin.
Na saa de etoso mienu de nipadua ne de e de insulin eba.
But the insulin is not working well.
Na so insulin na entumi eye na dwuma yie.
So the insulin is not functioning properly.
Na akwese insulin entumi endi ne dwuma akasa ese odi ne yie.
This leads to an increased blood sugar level.
Eno na ema mmoja ewo ye sikra ewo ye mmoja no mu ekosoro yie.
And the third type,
Na de etoso miensa no,
is called gestational diabetes.
the friend gestasia esikyire yare.
If you are pregnant,
Ono ye omo a omonyem no.
you are not diabetic before you got pregnant.
Ebi wo wa ono esikyire yare ansa obefefu.
But during pregnancy,
Na so enam se wa fefu nti,
you may develop diabetes.
enam so obetumi enye esikyire yare.
This diabetes after delivery may go away.
Na saa esikyire yare we de wo ya ebetumi akọ.
I've mentioned 3 important signs and symptoms of diabetes mellitus.
Na mabobo nyoma akoro miensa so a enam so e de esikyire yare eba.
You want to visit the washroom frequently.
Ne din ka chawo se ema wutumi kọ edwaye ntantam so ara.
You feel like drinking water frequently.
Esa so ma wo kondo so benu nsuo ntantam so ara.
And you are hungry.
Ema ekom so de wo ntantam so ara.
Apart from these 3, there are others.
Na enoma mense fi wo no ma afoforo nso ewo.
There is increased fatigue.
Na akwaye se kasiye bi nso abehye wo ho.
Blurred vision.
Na woni a enhu ade yie.
If there is a sore on your body,
Anase wonye kuro bi ewo woni pedue mu a.
there is delay in healing.
Eya na eche ansa na etumi ewu.
The gums become soft and tender,
Na wo se echi na no abeye memremre bi sei.
and the skin itches a lot.
Na afi woni pedua mu na ankasa ekeka wo ankasa eyie.
And also there is unexpected weight loss.
Na afi ofiri mu a na wahwere mu duro so.
These are some of the symptoms of diabetes.
Na we nyina ye nneoma ebo ye kokose yenya esikyire yare.
If you noticed any of these,
Na se wutumi hu saa nneoma we bia,
please do not delay.
nisrawara enche.
Go to any hospital
Esa wutumi kwa ayarsabia
and see a physician,
na okorehwe datilbi.
and you will be diagnosed and treated.
Na se wo se wonye bia, wo beso yare.
Diabetes can give us a lot of complications.
Na esikyire yare betumi de atete nneoma bebre amaye.
There is stroke,
Etumi na wonya stroke mpo.
blindness,
Etumi na woni fra.
heart disease,
Etumi na wonya akomayare.
and kidney disease.
Etumi ma obra bo nso eka.
If you have stroke,
Se wonya stroke bia,
it's difficult to live a normal life.
eye de so beba abrabo a edimu.
So if you are diabetic,
Nti se wo esikyire yare bia,
knowing of these complications,
na wo nneoma wo ye ekeka ho nyina no.
you have to take good care of yourself.
Ese wo ye ahweyi akasa ema wo ho.
And you seek early medical care,
Na ntampa wo kwa ayarsabia.
and you will live a normal life even though you are diabetic.
Na wotumi abo abrabo edimu mpo se wonya esikyire yare bi.
If you go to the hospital,
Se wo kwa ayarsabia,
there are other tests that will be done
wo mo betumi ahwehwe wo nipadua no mu bebre.
to confirm diagnosis of diabetes.
Ema wo mo ehunu pefe se ne kure ni wonya esikyire yare.
For the treatment,
Ewo se ye behwe wo so no.
we talk about your diet.
Yakasa fa wo aduane di mu.
It's good to eat a healthy meal.
Ese wo di aduane a amodin wo.
We have our breakfast, our lunch, and dinner.
Ye wo aduane ye di na anapa ye di na ewia ni na ye di na ewure.
Adhere strictly to these 3 course meals in a day.
say yetumi ya hwe yie say betumi adi anapa aduane ewie aduane na ewie aduane yie.
If you are diabetic, do not omit any of these meals.
Na sa wo hwehwe mo ehu say wo wasi kire yare bibi a wo aduane di mu de emfa dutu fo mo.
Do not omit some of them. Some people will eat their breakfast and they will eat only dinner. If you are diabetic, eat your breakfast, lunch, dinner, in moderation. And then in between, you can have some snack. But to avoid your meals will also contribute to you developing more complications. Talk about discipline yourself. Most especially with snack. The sugary foods, fizzy drinks, it's good to discipline yourself about them. Increase your fruit and vegetable intake. For type 1 diabetes, they give them insulin. The hospital, they will teach you how to use insulin. There are other tablets that you can take. These are all prescribed by your physician. It is very important that you get a clear education on how to use your medications. If you are diabetic and you omit your drugs, it is difficult to control the sugar. So if you are diagnosed and you are put on treatment, follow strictly the prescription by the doctor. And then also, diabetes can give you sores that do not heal. So we advise that you take care of your feet. If you wash your feet regularly, you have to inspect them. Are there any blisters? If there are blisters, you quickly go for treatment. And when you are wearing shoes, don't wear tight shoes that do not allow circulation. But rather wear shoes that are free on your legs. If you have glucometer, you have to use it to check your sugar daily. And then you go for a regular checkup at least every month. Take care of your teeth. Regular brushing and cleaning of your teeth. If you are overweight, try to control your weight gradually. I believe we have learned a lot today. Diabetes is very dangerous. But when it's detected early and you are treated, you can live a very normal and peaceful life.
Wobetumi aba abraba edi mu a asomdwe nso ewo mu.
Complications can only come if you do not take care of yourself.
Nneɛma bi betumi abɛtoto wo mmerɛ a wontumi hwɛ wo so yie.
If you are detected that you have diabetes
Sɛ yɛtumi ahu sɛ woanya esikyire yare yi bia,
and you are given treatment,
na sɛ yɛhwɛ wo di a,
please follow strictly.
bas kyɛw mesrɛ mo sɛ monni akyire yie.
And you regularly, at least once a month, visit your doctor for checkup.
Mesrɛ mo bosom biara mu mobɛtumi akɔ ayaresabea ɛkɔhu wo doctor.
And if there is a family history of diabetes,
Sɛ abusua no nso mu no, obi wɔ esikyire yare bi wɔ mu a,
take care of yourself,
ɛsɛ mo hwɛ mo ho nso yie.
especially with your diet.
Ɛn kankan a ɛyɛ wɔ aduane di so.
Thank you so much. We'll meet again.
Medam ase bebree, yɛbɛsɛn ahyia bio.